I'd say the macro issue that is really, and we should all be alarmed as some citizens, consumers, maybe we're getting a little older. If you think about what a high-end fashion brand, for example, can do in a tariff environment or an inflationary environment, they can't do it. So a lot of these health systems can't raise prices. They're limited by the state that they're in. So they just take it on the chin. So if prices go up, they can't pass it on to the consumer. So they either have to cut staff, which in their business means at an absolute minimum, really hard to deal with for claims and appointments and things of that nature, but at a maximum, nursing and capability. We might have to close, the eye clinic or the heart clinic, whatever it may be, or they have to downsize the ratio of patients to doctors and nurses to doctors. So it's really alarming what they have to do. So there's an urgency there that they need to drive cost savings as fast as they can, and ideally not on the stuff that's going in your body. You don't want your hospital cutting cost on the MRI machine or on the knee replacement or on the heart valve. But the snow removal and the window cleaning and the security guards and the software license. And so that's one big thing we saw right away, is that they need it badly. And we're doing a real good thing when we can help them. And we are helping our communities have better health care. And it's amazing. And that's not a marketing shtick. It's true. And it's really cool. And I've never been able to say that until we started this business in healthcare a couple years ago. The other thing, one of our healthcare executives, CFO, said this, and he was so right. He said, and I've got 3 daughters, so I say this with a grimace. Hospitals get wedding pricing. And when he said it, I said, come again? And he said, we all know the tent doesn't cost that much. We know the flowers don't cost that much. And we know the photographer doesn't cost that much. But my daughter's getting married. So now all of a sudden it's 4X what it would be on any other given Wednesday for a tent or a photographer. And I got to tell you, with empirical data, I can show you same supplier, retailer, hospital, CPG, hospital, insurance, hospital, hospitals get crushed. They don't get good pricing. And if there's anywhere you're going to give a discount, you'd think you'd give it to your community where they're providing healthcare to your friends and neighbors and family.